Generally looks like nutraceuticals, stress management. Oh, she has lupus. So lupus is another one. And again, it depends on the severity. So I also check kidney function for lupus and look at some other parameters that will determine on the advancement of the disease. And the goal would be to decrease the inflammation first and foremost, do healing of the body so that the symptoms are minimal. So with lupus, there can be so many things down the road that can cause, you can have the arthritis with it, you can have some really damaging things that happen, kidney damage, as well as other vascular damage with lupus. And so the goal would be to prevent that. So it depends on where you're at, what your ceiling is for healing, but I would still go straight to, what kind of lifestyle, nutritional, and I say that very generally. There's a lot of specific things we can do to be very intensive, and just staying on top of testing to monitor how well you're doing, as well as looking at your clinical symptoms.
So the other thing too that I will say that sets me and Dr. Crystal apart with, if you had your traditional lupus diagnosis, I have some family that actually deal with lupus. So the way that we are going to take care of you is going to come from a functional and holistic standpoint. So we're going to address, again, your diet, your lifestyle, your overall nutrition, and what's going on with that, and different things that we can help to really get you to where you need to be. And we use herbs, we use nutraceuticals, we use functional movement,
it takes everything.
It does. Really. It really does. It takes everything to
and we want to support
get you to that point
where you're at, because some people are really good at this part of it. I have lots of people that do really well with the diet portion of an autoimmune disease, but they're not doing well with some other things. And so we really work with where you're at to move you forward. So,
right.
Yeah.
So, with that being said, we were going to talk about magnesium tonight, and we already mentioned green leafy vegetables, right? I feel like we talk about those all the time, but they are really, really important to your diet and to your overall health to get the nutrients that you need. And most of us are nutrient deficient in one way, shape, or form. And sometimes, people think, oh, well, I'm fine as long as I take a good multivitamin.
Or I eat some vegetables, or I don't eat too poorly, but I really evaluate what that means.
Right.
And so one of the things is green leafies, which covers, like you said, there's so many different things can be helped with eating green leafies. Calcium is another one that we don't think about. But beans, legumes is another good way to get magnesium. Nuts, seeds are great ways. And so if you're not eating a high plant-based diet, number one, that's going to be a main reason why you're going to be deficient. Gut health, if you ever had antibiotics, absorption, all of those things are going to be huge factors on whether. But across the board, all of us have issues.
Right.
And what Tika sees a lot, because we just talked about this. So we are planning, and you're going to have to give us some timing grace. We're planning because some of this stuff is hefty information. We see it all the time in practice. Is that she sees babies that are a result of mothers being nutrient deficient. And then we also see this, we're talking about epigenetics, all the way up the chain with mothers being deficient because their mothers were deficient, because their mothers were deficient. And so it is so important to break that cycle of deficiency. And it's not just magnesium, there's other multiple things, because we were talking about a lot of times with some of these not really disease processes, but just conditions that are caused by nutrient deficiencies. We want to take and say and just throw all the vitamin D at it. Oh, it's fine, but it's not just one. Really, we need to be comprehensive. We're talking about magnesium by itself. It is not just magnesium. There's not green leafy vegetables don't have just magnesium. There's a reason why a lot of the things that we eat have multiple things.
Yes, and that's actually what we were talking about specifically, because what'll happen is people will kind of get fixated on this one thing. So they will say, hey, children, you guys are really, really loud. So y'all got to keep it down or go into the other room, please. But we'll get fixated on one thing, and we'll say, oh, well, magnesium helps with the heart. So I'm just going to take all this mag and that should just fix it all,
Yes.
But really, what you want to do is change the diet, change the lifestyle, lower the stress, right? Get the green leafy vegetables in there. And then if we still need to do some supplementation, yes, we can do that. But we want to make sure that we take care of the foundation and the whole picture, because just magnesium isn't going to get it. I see a lot of mamas that have MTHFR, and so I've mentioned that before, and that's a huge, giant subject.
We're going to talk about it, but just not just yet.
One day we'll talk about it, because I feel like MTHFR would take several different Fridays to be able to, really just get down to the brass tacks of that. But when I have babies that come into my office and they have been to the lactation consultants, they've been to to their pediatricians, they've been all these different places, and they've gotten a little bit of help, but they're still having all these issues, I will say there's always an underlying something that is going on. So what I do is I spend time my histories take a long time. But I want to know all of the things about you. And I also, I look very much at these babies and at a lot of the signs. So, I don't know if you guys have heard, of a sugar bug, but that's that vein that sits right here. I don't know why it got that nickname. That's the strangest nickname for this vein right here. But the sugar bug, the stork bites, the sacral dimples, and the sacral dimple, as a NICU nurse, we used to look for sacral dimples, but I didn't know why we, were looking. I knew why, but I didn't, if the sacral dimple didn't go anywhere, I didn't worry about it. You know what I mean? But those are signs that something is a little off. And so if we're seeing sacral dimples, stork bites, we're hearing heart murmurs, we're seeing sugar bugs, and then I'm also seeing, babies not gaining weight. I'm seeing, moms having issues keeping up their milk supply, and their nipples are hurting. All those things are reasons that you want to come in to be assessed to make sure that there's not something else, because there is something else going on. I'm not going to say.
And so our goal is, for us, when we're looking at it, is when you're in the medical setting, a lot of the times we are seeing the effects of these things, and the goal for us is to reduce those amounts for multiple reasons. But it's to reduce those. And so when we're talking about some of these topics, it's just to open up. This information is out there, but it's to open up and see what is unique to us as we take it and we put it in this big picture.
So the reason I don't know if she answered that or not, but I look at stork bites specifically because stork bites, sugar bugs, sacral dimples, heart murmurs all run along the midline. So, and when I'm talking about midline, I'm talking about like your first 4 weeks of life, and within your first 4 weeks of life, that is when all of your midline stuff is forming. So that's that time is when your folate, right, is really, really important. And where do you get folate? You get folate from green leafy vegetables, which is like why I feel like we're always talking about green leafy vegetables. But me and Dr. Crystal were talking about it because I have these moms that are like, I don't understand how and then that relates to tongue tie. So I deal a lot with tongue tie also with babies. But I will have moms that'll say, well, it can't be that because I have increased my amount of folic acid, and a lot of people don't realize that if you have MTHFR, folic acid is not what you want to be putting in your body anyway. Yes. You really want a folate, and you want a methylated folate. But even if you take increased amounts of methylated folate, if you aren't also doing all these other things, meaning with the diet changes, making sure that your other nutrients are where they need to be, then you can still have issues. Because if you take a lot of so what Dr. Crystal said about green leafy vegetables having all these other nutrients in it, right? Magnesium is one of them, and so many other things. You can be taking all this methylated folate, which is one of the things in green leafy vegetables.
Really not making the difference that you need to
because
make.
You don't have all these other things as well. And you need to have you have to be whole. And that's the biggest thing with with what we're trying to do, or what we do at Total Family Wellness, is we want to create a whole. We look at the whole person, we look at the whole body, and we're going to look at you, at your baby as a whole. And that is, we want to make sure that, you know, you're not nutrient deficient. And so what makes what Dr. Crystal does awesome is that, you know, yes, she does testing, but she does advanced testing, and she does testing that a lot of your traditional tests, you know, aren't gonna be. So and for a lot of y'all that don't know us personally, you know, I think what gives us a little bit, you know, a lot of an edge is, yes, I'm a lactation consultant. Yes, I'm a health and wellness coach and herbalist. I'm also a nurse, and I spend a lot of time in the hospital. And Dr. Crystal is a chiropractor, but she's also a nurse. So we understand the medical side, but we also understand the alternative and the holistic side. So we have a good balance and marrying of the two. And so you can come and see us, and we're going to be able to address and look at, you know, the things that you have going on from both standpoints, because I definitely feel like, you know, there's a place for, you know, Western medicine, and there is also a place for, you know,
I feel like
holistic care.
We merge it in a way that is unique. I think, and not only that is our skill set and understanding and expertise, is I really think that we have a knack for rapport and relationship with our patients.
Oh, yeah.
So if you ask them, I think, I mean, because we genuinely care, we genuinely have a love for what we do. So that I think does transfer over to that. And if we don't have an answer, we work hard to find an answer.
Oh yeah, 100%. So. There is no certain age that I stop. I love babies. My favorite babies, and for me the most rewarding, are older babies. I feel like there's a lot of care out there. Someone just asked, because I have, you know, most people will see their lactation consultants, you know, within that first 6 weeks of life. And then unfortunately, a lot of insurance companies will only give moms, you know, that first 6 weeks. So they'll give you 1 or 2 lactation visits, where for me, I can surpass that. So we are a full service medical clinic. I am a nurse, you know, so I've worked postpartum, NICU, mother, baby, all of the things. I've even done some bariatric. I did resource, so I mean, I've been everywhere. But I love older babies. I love working with them. I love watching their milestones, helping moms work through the challenges that older babies will have. And I will say that a lot of lactation consultants aren't comfortable, you know, working with the older babies. So I get a lot of clients that, you know, will come in and say, you know, well, my baby is, you know, 3-4 months old, and I don't have that much milk, and I don't know what's going on. And they've gone into, you know, the hospital or to, you know, just a traditional lactation consultant, and they'll tell them, you know, well, it's hormonal, so, you know, you might as well start, you know, supplementing with formula. And that doesn't have to be the answer.
We have a lot, I will say we have a lot more, we're open to a lot more alternative holistic answers for a lot of these things. And so, because she has a daughter that's a year old. So yeah.
I definitely can work with your baby. I work with all ages of little people. Little people are my favorite. So I have some, you know, I have some toddlers. I have some,
you know, 6 and 7 year olds.
I was going to say, I don't even know what age that is. What are 6 and 7 year olds?
They're just children.
Oh, okay.
They're just children.
I don't know what they are. Because I think adolescence is more like 11 and 12.
Yeah, right before preteen.
10, 11, 12, and then they're like teenagers. I actually have a couple of teenagery clients as well. Mm-hmm. So, I mean, we can work with anybody. I just have a passion for babies. And then as far as coaching.
1-year-old would be babies.
What'd you say?
1-year-old would be babies. That's still an
infant.
That's a baby.
Yeah, that's a baby. And I mean, you know, when you're talking about breastfeeding, biologically, we should be breastfeeding until we're, you know, 5 to 7 years old. It's just that here in this country, that's not what we do. So as far as the issues that I was just speaking of, if you're concerned about those things, then yeah, I mean,
I would say contact Montika. She can really answer some
we can talk. We can talk about that
because it's never too late. It's never too late.
It's never too late. I have some clients that I will be seeing them for their baby, and then we will. And then we'll be talking about them, and they'll say, you know what, my 3-year-old is doing that or did that, and my 6-year-old, and my, whoever. And so then we can start talking about those things, and that's where, I'm talking to them about some of the issues that they had when they were younger. And then it's great because I'm able to pull Dr. Crystal in at that point, and I can say, you know what, this mom is having this issue, this dad is having this issue, we're seeing these other things, I'm seeing this deficiency possibly, and then they can
and then if they
set up with Dr. Crystal.
Yes, and then if they want to have more children, we're setting them up to be more successful.
Yes, because it's great to make those changes so that you can see things change. Because what I see those issues getting worse with subsequent children. And what I see in moms that make the health changes, I see things improving with subsequent children.
So whenever you go and you see a traditional medical doctor, you're seeing and there's like, oh, this can't get better or whatever, it's not true. We see things improve all of the time, and that's clinically in the clinic, from symptoms and from conditions all the way to labs. And so I'm going to shift a little bit back, so when Montague comes back, we can talk about magnesium. And so some of the things we see with magnesium deficiency is going to be very, very general, vague symptoms. And so these are going to be things like fatigue. It's going to be things like muscle weakness if it's extreme. Muscle cramping can be another one. So all of these are not dependent of just magnesium deficiency, but most people have a deficiency. We're not getting enough of the things that are going to contain magnesium on a daily basis. And so the best way, besides coming in and getting evaluated, among other things, to see if you have a magnesium deficiency, is there's a test that I love. It's a micronutrient test. I love it to be able to assess if someone has a magnesium deficiency, and it doesn't just check magnesium, and then we can go from there. However, a lot of times when Montique and I see clinically some things are going on, magnesium is a great supplement to go to, because there's not really any harm in it. Can you be harmed by it? Absolutely. You can take way too much, but that's why a lot of times.
But when you take too much mag, you just get the runs.
Yes. Now, but
that's not the nice word. You get
diarrhea. But if you're under our care, we're managing that. We're monitoring that. We're not going to put you on this dose that's going to be extra helpful. There's no magnesium in white
that
wine.
Is apple juice.
Apple juice. So there's some other things. One of the things too that Montica uses magnesium for, I use it. So I have a lot of patients that are just stiff, tight muscles all over, and so I use a lot of nutraceutical formulas that have magnesium in it that will relax the muscles. So when you don't have enough magnesium, a lot of times your muscles will will not be able to contract and relax, so mainly relax the way they're supposed to. So right. I will do that. There's other herbs and things that can work well with that as well. Another thing that we see when we're talking about our moms with magnesium is they treat preeclampsia, so hypertensive pregnant women with magnesium, and a lot of times it can be brought on by not enough, and they even treat non-pregnant people with magnesium as well.
I have a lot of my breastfeeding moms, or if I have a breastfeeding mom, I have one not too long ago that was taking mag for her pressures being up. Mm-hmm. And it was really, really helpful. One of my favorite things with magnesium is magnesium oil, which is super cool stuff. Mm-hmm. You can make it yourself if you're crafting. You can buy mag flakes and put it in water and boil it down and do all the things.
So let's talk about that. So besides just eating green, because some of us, I already know, some of my patients will be like, I cannot eat green leafy veg. I don't know why I love salad. I took a couple days off after I found that inchworm.
There's some pretty good green drinks out there too.
There's some green drinks.
That are great.
This has been around since forever.
I'll give my Purium plug because I thought I saw Celeste on here somewhere, but I like their Power Shake. It's really yummy.
Oh, the Purium.
Yeah, it is. It's good, and my kids even will drink it. It's good stuff.
But eating foods
and it's
normally is some of the best things you can do. Number one,
yes.
But also working on gut health and absorption. It is a water soluble. It's a mineral. But here's Epsom salt, so you can do a soak. So one of my goals in life is to have a soaking tub. I will have one next year is my goal. But this is something to soak in. You will feel itchy a lot of times. There's also magnesium gel and magnesium cream that you can have formulated at some of the compounding pharmacies or purchase them. We have companies that actually sell them that we can order them for you. The downside to gels and creams,
okay, what is that?
Is absorption in the skin, depending on your skin.
Oh, okay.
But I don't know the
I was
formula
gonna say
for that.
one of the
And
ones that
dosage.
I am aware of that's over the counter smells like vanilla cupcakes, and I don't like
That kind of smell on your body.
vanilla cupcake smell rubbed into my
I don't
stuff.
either. But this is a good way. Like, it's a good. You can just soak in the tub. It's
Okay.
a great way. Yes,
Epsom salts.
and it's cheap. This stuff is super cheap. But then, like creams and gels, I've used magnesium gel before. One of the companies we use sells all of those things.
Yeah, but they have a mag oil spray. So like for my babies, so a lot of times, when babies are stressed out and just going through, and you'll have a colicky baby, or you'll have a baby, let's say, that just had a tongue tie release or something like that. One of my favorite things to tell mamas is you can get the magnesium oil spray, and you can do a couple of sprays in your hand, and you always want to dilute it out, because a lot of times if you are deficient in magnesium, it can be real tingly, burny, itchy, and it's not fun. But it can be like an uncomfortable itch.
Every time I take an Epsom salt soak, I'm itchy. Well, what does that mean?
I don't know. But if you spray some in your hand, you can mix it with your favorite baby lotion, and you can do like some different infant massage techniques and rub your baby down, and it is very relaxing, even for your baby. Or you can get in a bathtub if your baby isn't wanting to nurse and they're freaking out. You can get in a tub with Epsom salts, whatever your favorite brand is, and you can get in there with your baby, and a lot of times you're relaxing, your baby is relaxing, and they will go on ahead and nurse. And for my essential oil mamas, you could drop a drop in there or diffuse some,
So
you know what I
many
mean?
awesome things
Different
you can
things that
do.
you can do. You can have your Epsom salts going, have your oils going, and chill. And it is so helpful. Epsom salt is a muscle relaxer. So that's why we were also talking about
And I call
muscle.
it a natural muscle relaxer.
natural
because
muscle
when we
relaxer.
talk about muscle relaxers, there's a prescription,
yeah,
several forms
that's
of
true.
muscle relaxers. And so the good thing is that there's not really going to be side effects to something like this, because it's a nutrient that your body needs.
Yeah, and
to
that's not just for
function.
women. My husband,
Yes.
my husband does
absolutely.
MMA fighting, and I mean, like, he will get Epsom salts in the tub and he will soak. I mean, because it is super helpful. So runners, athletes, fighters, it is great stuff to help
and so
you
it's
to
not
rebuild.
only muscle, but your heart's a muscle, right? All of these things, and if we look at, I don't know how we're going to do it, but when we talk about all of the physiology and biochemistry and the cell cycles and the methylation pathways and all of the magnesium, I think, has 400 plus functions in the body. 400. So if you're deficient, guess what? And this is in the cells, and so we're not going to talk about all of them today, because to be honest, I don't know 400, but like 398. I'm just kidding. But if we don't have those here, it's one of the cofactors of a lot of processes that are for cell functioning. And so at the bottom line, what it means is if you are nutrient deficient, magnesium is one of the biggest ones that we see, your cells are not functioning optimally. When your cells are not functioning optimally, you're aging faster, you're not functioning optimally. We're made up of cells, right? And it's exactly that way. So those are things we have to think about.
Yes.
We talked about the different forms. We talked about how to test it, how it makes us feel. I don't know. Do we need to talk about anything else?
We kind of talked about bowels, but we also talked about bowels in the way of, like, when you get too much magnesium, you having diarrhea. But on the flip side of that, I know so many people that don't poop regularly. And that is, like, a big
That's
deal.
most people.
Like, people think that you're not supposed to poop every day.
Every
and you
day.
actually should poop multiple times a day. Yes. So when you think about babies pooping multiple times a day, or when you get a new puppy and they poop, you train them, because after they eaten a little bit, they're going to need to poop.
Now, I will put a caveat, and we're not talking about people who have bowel disorders that have diarrhea several times a day. We're talking about
I'm not talking about
good
diarrhea.
bowel movement. We're going to talk, you know what? That could be our next one. We can talk about what's a proper bowel movement.
Poop. Oh, well, okay. A proper bowel movement.
We're going to talk about poop. It is important. Poop and sleep and
poop
thinking
and sleep
and
is important.
not together.
Yes. Don't poop while you're asleep. What are you talking? I wasn't saying it together. Anyway.
Sorry.
If you're not stooling properly,
Yes.
that can also be a sign of having having a magnesium deficiency. And magnesium is really, really helpful. So one of the things that when I was a nurse, I am still a nurse, but when I worked in the hospital as a nurse, one of the things that we would use for people that had, you know, constipation was milk of magnesia. And so many people are familiar with milk of mag, but it's so much better. Milk of mag has so much other stuff in it that is not good for you. So it's gonna be much better to get mag by itself in a natural form. You know, old people used to say get your roughage for a reason, you know, and when you get your roughage was your green leafy vegetables.
Because there's also not magnesium, there's going to be fiber in there too. Cellulose, which is the cell walls, the fiber that's going to help physically push out some of the that carries. And listen, your poop we're going to talk about poop because your poop carries toxins and other things, and it pulls cholesterol and all of those things.
It's better out than in.
Yes,
get it out. So we just wanted to talk to y'all about magnesium tonight and how important it was in some different forms. And come see us on Sunday. Yes, we will be there.
If you're in the Tulsa area.
Yes, it's going to be fun. So we would love to see you guys. Not only us, there will be several other holistic vendors there.
Yes.
Talking about what they do and sharing what they do. So come out. It's the Oklahoma Holistic Health Conference
at the mansion.
I think it's Woodward Park.
It might be Woodward Park. Mansion at Woodward Park.
We'll post it. You guys have a good Friday evening.
Enjoy your
weekend. Thank y'all for joining us.
Bye.
Have a good one. I don't know how to stop this. Oh, there it is.